Hi, this is Dr. Saxena, and as usual, we are trying to. This is one of the series we are trying to empower the people who normally get some health problems. In order to understand the health problems, we are in this thing called environmental medicine, as well as what we are trying to work it out. We want people to understand what are they up to, what are the things they need to work it out, what is the best diet for them, what is the kind of best measures where they can always figure out, trying to look into something, what are the polluting things. Because I believe there are two things which we are up against. One is something called stress, which is always haunting, and it's always a difficult thing trying to balance between this daily muddles with this stress. You are always on the word go. And the other thing, what I believe, which is really a nasty thing, is the pollution. If I can go into pollution, I can always talk about something like numbers: pollution due to food, water, and air, pollution due to electrosmog, pollution due to sound. There are so many things in the pollution part. So, but I believe if you are not able to understand this particular stuff, what I'm talking, if you don't understand what is pollution, because you will keep on, you will keep coming to a doctor through a revolving door again and again. You will get a problem, you will have a block in the right coronary artery, and you get a stent. After that, what? After some time later, you'll again have some other block. Usually, most people don't get into that, but sometimes has become the order of the day. So I'm not very happy just trying to treat 2 centimeters of your block, or hardly a few things as such, a few inches, and ask you to come again and again. So what happens is you need to work out what is this thing called atherosclerosis. What is it? Is not just the kind of cholesterol or something like that. You need to look much deeper into that. Yes, I'm talking about something like pollution. When I talk about pollution, I talk about so many things which is there in the water. I try to know what is the hardness of the water. I'd like to know what is arsenic level in the water, what is the lead level in the water, are you using something like groundwater or surface water. Absolutely, because some things have changed drastically over years, which we have never seen before. I see people having they consume some water which is really has the content of the water they are not aware of. It's high time you should look into what is the content of your water. When you look into content of water, you'll understand why I'm talking about. People always, I have a glass bottle now because I somewhere, I being a kind of informer, I want everyone to follow that. Don't start use that plastic bottles and all that. So you are up against pollution in a big, really big way, and just by treating the tip of the iceberg doesn't mean anything. You are still left with a physiology which has to be which is totally not balanced. You need to balance that physiology, you need to correct the biochemistry. There are some things which has really caused a big issue. By the time you get into a symptom, the symptom just appears like a tip of the iceberg, and you just can't press down that tip of the iceberg and show that everything is fine. No, it doesn't go like that. So this is what we try to work it out. This is a pure we work on this thing called integrative medicine, and where we would like you to understand what are the things, what are the toxins, what are the kind of things which are causing you to get into that disease at first place. You need to understand that, and you can always work it out once you know what is your major problem, what are the things which has gone wrong in your physiology, human kind of thing. But it is highly not probable to just do a kind of I'm not interested in doing that band-aid approaches and all that. You just fix them with the bandage and you remove the bandage, the problems is still there. So if you want to look beyond that, welcome to integrative medicine. Thank you.